I want to give the floor to the colleagues of Bax company, as I was saying, to present in more detail the healthy cities generator, which is a tool that was existing prior to the project, as well as the Wakamola digital solution. But we took the opportunity of HORUS to iterate them, to improve them in somehow from the data and the analysis conducted within the project. And this is the result of this improvement process. So Ruth, when you're ready.
Thank you, Tamara. So yes, I'll briefly present the Healthy Cities Generator tool, which, as Tamara was just saying, is a tool that has been developed previously. And within the HORUS project, we're testing it and improving it to make it more adaptable to use with citizens. But to begin with, I'll explain a bit what the tool is currently like, and then we'll end also with this updates that we're doing within the project. So the Healthy Cities Generator is a digital tool. It's available online, and it was designed to show the relationship between urban development, urban plans, and health. So it's based on a methodology that was based on a literature review of the scientific evidence that was available. And as a result from this process, we linked 20 urban determinants of health. So these are aspects of the urban environment that as planners we can influence. So related to issues like density, population density, business density, but also mobility, greening, access to different services, etc. And as a result of this research, we linked these 20 urban determinants to 30 health indicators. And these cover physical and mental health issues, and also environmental health and lifestyle factors, which, as you know, within HORUS is one of the main focuses for us. Next slide, please. So the Healthy Cities Generator tool was also the result of an initial review of tools that were being used at the time. So there are a number of tools out there that link different aspects of the urban environment to health. But what we found is that these are usually either very narrow in scope, so they only focus on one or two aspects of the urban environment, linking it to specific health issues, for example, linking mobility or green spaces to mental health or physical health. And the tools that did offer a slightly wider scope and a more holistic view of both the urban elements that interfere in health and the health outcomes were fairly limited, but also they were very complex or fairly complex to use. So what we found is that especially medium to sized cities had often difficulties in being able to use these tools adequately, either because they didn't have the capacity or the time, they didn't have the necessary data that was required, etc. So we started developing this tool as a solution to that, so to provide a tool that was easy to use, that wouldn't require complex data from the users. And this would then also ensure that it's flexible and can be adapted to different contexts. As I was saying to begin with, it's also evidence-based, so based on several reviews of the literature that have been updated. It was tailor-made to support practitioners, people working within urban planning departments, but also health departments, to be able to drive the process and integrate these health considerations into their work and into their planning. And it basically allows you to do three things. So first of all, you can use it as an analysis tool to assess the current situation of the area, of the neighborhood that you're working in. Then you can see the health impact of different urban development actions or different plans that you're working on and will be implementing in a specific area. And lastly, you can now also use it to see the economic impact that could be achieved thanks to these health improvements. Next slide, please. So at the moment, the process of using the tool consists of these three stages. First of all, to assess your current area, then to review the impact that you can have via the interventions that you have planned, and lastly, see the estimate of these savings that could be achieved. Within the HORUS project, we're now building this fourth step to complement the previous ones based on engagement. So within the HORUS project, we had the opportunity to run a series of community workshops, focus groups, and interviews in the 3 pilot cities that are involved in the project. And as a result from this, we're now adapting the learnings and building this module within the tool, which will make the tool usable in these contexts. So we can use it directly with citizens to gather their input also on their area and their urban environment. Next slide, please. So now I'll walk you through each one of the steps, starting with the baseline assessment. So the first part is to assess or to choose which health priorities you want to focus on. So out of all the ones that you can hopefully see here, you can select those that are more important. And then on the right-hand side in the graph, you can see these urban determinants of health, which ones are more directly linked to our health indicators. So this gives you an idea of which aspects of the urban environment you need to focus on in order to address these health issues. I think it's paused, maybe, the video. There should be another bit. Okay.
It works or not?
Yeah, I think now
To
it
me,
is working, no?
let's start. No?
Perfect. So the second part of this initial assessment would be to assess the baseline situation of your area. So what we ask here is that the user rates on a scale of very negative to very positive out of 7 different options, in which state their current area performs for these urban determinants of health. So in terms of population density, business density, etc., how they rate their area currently. And then you can see on the right here, we also provide a visual representation of this baseline assessment of the area and the needs diagram. So basically this needs diagram takes into account the goals that were established in the previous step and factors them depending on the baseline. So if you had a big goal for increasing green coverage, but then in your baseline, you say, actually the area that you're working in has good access to green spaces, then this will decrease the need for having to focus on this aspect. So basically, this means that it also adapts the results and the process to your own situation and the area that you're working with. So this would be the last part of the first step. And then I think on the next slide, we can see the second step. Great. So in this second step is when we ask you to input information on the urban plan or the urban interventions that you are working on. So you can split these into different actions. And again, here, what you would do is rate the impact that each one of these actions will have on the urban determinants of health. So similar to the previous step, but this time thinking about the impact of what the different actions that we're promoting could achieve in the area. And here you can also see, well, at the top, we had the list of the 30 health indicators. So you can see how this action specifically is impacting each one of these, as you can see here for mental health. And then down below, again, you have the action profile, where you can see how the impact is spread around the different urban determinants. And then the needs diagram updated with the impact from this action. So how this action is helping you to achieve the different needs that we established previously. And then in the final step on the next slide is when, I think maybe again. Perfect, yeah. So now we would be looking at the results. So first we provide these 3 headline figures. So your Healthy Cities score, the estimated savings and increase in life expectancy. And then we go section by section looking at improvements to the urban environment, improvements to health, so how your plan will be improving the health. And again, we provide these estimations of gains in terms of life expectancy and also premature deaths avoided. Then we provided data results per health indicator. And then we reach the economic impact section, where again, we provide the overall savings that could be achieved by the savings per person, and also a time frame of how long it would take for the return on investment of the initial investment for the project or the plan. And then per health indicator, again, we can see in more detail for each one, how much, what are the savings that could be linked to each one in each specific case. Okay, next slide, please. Again. Yeah. So hopefully that gave you an idea of the current tool and what you can achieve with it. As you maybe saw, it's mainly focused for planners, people with technical experience that are working within the local council departments, for example. And within the HORUS project, our ambition was to make this tool also usable as part of community processes. So as we know, in many occasions, when we're implementing changes in the urban environment in specific neighborhoods, we tend to engage with the community that are living there, and this is also encouraged more and more. So what we wanted to do was to use our tool also as a way to ensure that health was also, or was always part of these conversations. So making sure that when we are engaging with citizens, we place health at the center. And this also helps, we think, engage citizens in a more meaningful way, as they can easily understand the benefits of implementing certain changes into their urban environment, which may not always be clear what these benefits are. But our ambition is that by making it, building the story around health, that it is easy for these people to understand how this affects them directly. So the new module, as I said, its objective will be to engage also citizens in informing the initial baseline assessment. So what it consists of will be a series of questionnaires that the user, the technical person in this place, can create and set up, and then they can share via online forms or via QR codes to the communities that they want to engage with. So they'll be able to gather citizens' perceptions on the urban environment in these different areas using these online surveys. And then they will also be able to compare the results between different population groups. So filtering them to look into more detailed specific groups like elderly people or women, so that they can also compare within this community group, no specific profiles, to see if there are any changes or differences in their assessment and their perception of their built environment. Then they'll also be able to use this to inform their plan, the actions that they have planned, to ensure it's aligned with the needs of citizens and to see if there are any strengths or weaknesses based on the citizen assessment. And lastly, of course, this is a way of integrating the community's needs and their input into the decision-making process. So on the next slide, we can see already a bit what this will look like. So this is basically the dashboard where the user can access the form, and they can tailor it to their specific needs. And then once they've sent the form out, they'll receive all the responses and see it all centralized in this dashboard. So what we're seeing here is, first of all, the comparison of this input from the citizen process. So basically, citizens will have rated each one of the 20 urban determinants, same as the technical user in the initial step of the assessment. So here what we can do is compare the technical perception of this baseline situation with the citizen perception. So here we can already see if there are differences or not. For example, we did this very same exercise in HORUS, and we found quite large differences in terms of some of the more hard to measure aspects. So for example, street connectivity is something that initially we'd rated fairly high, assessing it from a more technical perspective. But then asking citizens, they found that this was in a poor state. They found it difficult to move around. So this also highlights why it's always important to complement our technical view and our technical analysis with their more experienced perception of the area of people that live there in the day-to-day. Something else that we can do is not only compare it to our initial technical assessment, but also compare it within different groups of the population, as I was just saying. So we can see, for example, if women rate some aspects better or worse than other groups, etc. On the next page, on the next slide, would be where you can see a more detailed view of all the responses that you receive from the survey, and you can create new profiles. So if you're specifically interested in looking into a specific neighborhood or a specific age group, then you can adjust this here, and then you can create this profile on this for this specific group. And then on the final page, you can see a bit what this looks like. So what the citizens would actually be filling out. Here we've shown it as a mobile format, which we assume would be the most common. And basically, it's a very simple and kind of visual questionnaire. So first of all, the user would have to reply to a couple of profile questions, which then later allows us to create these profile groups depending on age, gender, etc. Then they would see this list of 20 core questions or statements, so one statement per each determinant of health. So for example, here they would have to rate for population density whether they strongly agree or strongly disagree with the statement about where they feel comfortable in this area, where they feel that the density levels are adequate. And of course, here the wording is also very important. So we've tailored that slightly to ensure that the language that we use is very clear and easily accessible for anyone with no knowledge on specific urban planning concepts. And then lastly, we've included also the option for the users, so that the technical users, to include any additional questions that they might want to ask the community. And then we provide the Healthy City score as the final step in the assessment. So this is also a way of trying to gamify slightly, this questionnaire, and hoping that by achieving this score, maybe it's also a nice way for people to engage with other people in their area, to compare scores, and just in general increase the awareness around the topic. I think that's everything from me. I'm not sure if there's one. Yeah, okay, perfect. Then I hope that was very clear, and we can answer some questions afterwards, I think.
Thank you, Ruth, for your presentation. Now I will give the floor to UPB colleagues to present the Wakamola digital solution.
Hello,
I
everyone.
will make you
Okay.
amphitryon, so you have complete.
So I should move the slides by myself, or I ask you?
I think if I move them, you can see them moving, right?
Yeah, I'm checking if I can move. I can't do it, I think. Or is you moving? No.
I am not touching anything now.
So I cannot. No.
I will move them for you. No,
Okay,
no problem.
So hello, everyone. It's a pleasure for me to present the renovated version and image of the Wakamola app in this webinar, and that this has been developed with a great dedication by my beloved team in the Biomedical Data Science Laboratory in the UPB. Next slide, please. So this is a summary of the initial version of this digital solution that was created a long time ago, between 2018 and 2019. And it started as a simple chatbot that was only available on Telegram. And it was designed to collect data about users' healthy habits, and specifically related to diet and physical activity. And this was done through questionnaires that the chatbot was asking to the user directly. And the collected data was later on displayed to users so they can compare the habits with those of the wider community that were also engaged in the pilot or in the study that was running in that moment. Next, please. And now, thanks to major improvements and advancements, the Wakamola app, our digital solution, has evolved very significantly. And the key updates include, first, that our developers now use a more mature, if I can say, because I am not a technological person, but a program system that is the React Native, which allows to build and deploy the app both for Android and iOS. And this frees us from relying on a single platform like Telegram in the previous version. In addition to lifestyle questionnaires, Wakamola can now gather data from mobile sensors and monitor the usage, the use of the app patterns. And given the context of the HORUS project, which, as Tamara told, is focused on the urban built environment, the app is now able to integrate geographical data. And this lets us to map whether the users are near to predefined points of interest that are related to health promoting or risk behaviors in terms of diet or physical activity. And users can also view their personal statistics alongside data from the broader community or group. And in this case, they could see when the app is using their individual statistics in comparing them with the community or the pilot that they belong. And last but not least, the app now serves as a coordination tool for the HORUS project interventions. And this allows coordinators and researchers to communicate directly with participants through different kind of points or elements that you will see later. Next. So if we take a look to the app main screen at the center, you can see our iconic avocado star that is called Wakamola. And if we tap on it, we open a chat interface where the users can respond to lifestyle-related questionnaires. Also, users can report symptoms and track goals achievement directly through the app. And if we scroll down, you could see the second part of the screen, that is the second screen that you can see in the slide. The users can find a section for recommended actions and upcoming events that are suggested by the project coordinators. And it's all these events or elements are personalized to their intervention goals. So it's important to say that anything that the app is suggesting to the person is not suggested by Wakamola, it's not suggested by the app. It's suggested by some people that is behind the app. So that's important because it's not a medical device that suggests things automatically to the person. And finally, the outcomes section provides periodic feedback to the user's lifestyle data, as I said before, at individual level, but also at community level. Next. As mentioned in two previous slides, the app also acts as a delivery channel for the intervention itself. And this is made possible through the integration with a web-based dashboard. Next, please. And in this dashboard, the coordinators and researchers can define goals, create intervention groups, send recommendations, and manage events directly related to the intervention that each pilot is creating in their own sites. And also they can also monitor sensor data and the questionnaires results via interactive graphs, offering a comprehensive view of participants' behavior and engagement. Next. And this is a picture, an image from the dashboard showing the different intervention groups and the complete list of participants in the pilot. This is like the main homepage of the dashboard that is divided in these two main sections. And next. Okay, now I'm going to share my screen.
It's the video. It's the video. I am going to stop my sharing.
I'm going to display a video. One moment. ¿Me puedo poner solamente la pantalla? Okay. Can you see my screen? Okay. I'm going to do it. This is the first time I do in Live, so sorry if I do something that is not completely understandable. So this is the first thing that we see, and when we enter into the Wakamola app, that we see the avocado here in the center of the app, and we see that this is, if we scroll the main menu, and we see that there are some questions that are pending to reply. So we tick directly to the avocado, to Wakamola, and we start replying. In this case, we see that there are questions related to diet. I'm clicking very quickly, but you can see that in this case, the chat provides different kind of answers, and we need to select one of them. In this case, it is in this way because this is a validated questionnaire, and this is the way the questions are displayed in paper. So we have transferred this into a digital and chat way. And I'm going to move because there are several questions, and I don't want to bore you to be bored. And this we we should be starting. No, sorry, I want you to show to see other kind of questions. Yes, in this case, it is a questionnaire about the physical activity, and in this case, we are asking to the person to provide the number of days doing a specific kind of activity or the number of minutes investing, for instance, doing low intensity training or high intensity. So this is another way for the user to provide the answers that the Wakamola is asking. And now, yes, we go to the end of the questionnaire, and we see that Wakamola is very happy that you have been collaborating with it. And you see that now the text that is in the bottom of Wakamola has changed because there are no pending questions. You have replied everything, so you are up to date. So you don't need to do anything else in terms of questionnaires. But we can do more things, of course, within the main screen of the app. You can check later your stats or the results of your questionnaires if we go to the outcome section within the main screen, so you can see the results of your questionnaires in terms of diet. Sorry, because this is in Spanish, but I think it's very understandable. And this is also the physical activity, the number of minutes in total that you have done, and also by type, vigorous, moderate, and walking. And also, as we have been asking questions related to quality of life, we have divided into mental health and physical health, and you can also check here the results that the user have provided. And now we come back to the main screen, and here the user can report also symptoms, how he's feeling during, for instance, this week, because this kind of information can also be very informative to the coordinators team. So to check why the people have not been doing the expected activities, or if they have been being more inactive than normal. So maybe it's because this kind of reporting symptoms. So here the person needs to click the ones that represent better their status, but also they can put a comment. For instance, another kind of symptom, or you want to include a more qualitative aspect of your situation, and you can send it directly. And another thing you can report in the app is if you have achieved the goals, the intervention goals, the therapeutic goals that you have established with your intervention staff, with the intervention team. And it's important that the app, again, does not suggest these kind of goals by itself. It is built by the coordination team according to the person's specific needs. So they can click, I have done this, I have done this, or maybe another thing I have done during this week. And if you go out from this section and you come back, the goals are already clicked, so you don't need to do anything else. And the last part of the main screen is events and recommendations that for the person can see if they have pending things to do, pending recommendations to be done. But as you can see right now, there are no elements available for the person. But now we will change this, because now we are also interacting with the web-based dashboard. This is the main page. So you should, the intervention team should be entering their credentials here, and they start. They can enter into the dashboard. So the main page, it's divided in. It's very sensitive when you move. The main page of the dashboard is divided in two main sections. On the one hand, the interventions, so you can check here all the interventions pathways you have activated, but also the users. Right now, you only see myself, but in other images, you will see there are more people, or this is just an example. And if we go to the interventions, you can create a new one in which you can put here the name of the intervention. And here you have all the participants you have been activating Wakamola, and you can include them directly into those pathways. So you have now another extra intervention, and if you enter, you can check the people that is included in the intervention, and you can send also recommendations and events related to that, but we will see that later. And if we go to a specific view of a participant, for instance, here is Vicente. It is not 99 years old, of course, but it's just by default put in this way. And we can see the goals that he has achieved during the last periodic reportings. And also we can enter into the sensor metrics. We can check, for instance, the number of steps he has been doing, or the movement. This is everything related to the sensors from the mobile, so the information that it collects directly without the participant needing to do anything actively. We can display these results by day, by hour, by week, by different timings, if we could say. So this could be informing the intervention staff if our participants have been active or not in terms of the sensors monitoring. And also we can check the questions they have replied. In this case, we see the person has replied all the questionnaires, but also we can check the graphics. We can also check the communications or notifications we have been doing with Vicente related to their interventions. And also we can see if there are some contacts from Vicente or to Vicente in terms of something relevant. This is another view from another user. We are going to enter in myself, and I'm going to send to myself a recommendation related to our intervention. So we put here the title, we can put a text, and later we include there the starting date. We can use it, we can put it on hand, but also we can use the calendar that is on the right. So we send the recommendation to the person, and if we go just to the app, we should go to the recommendation section, and the person has just received that recommendation in live without just 1 second delay. So it's immediately this message sending. And we can do more or less the same with the events. We can create a new event to put the title of the event, and we can put later the content related to the event. If we can put a timing, or what we can include as well a Google Maps link, for instance, if it's a meeting point. And again, we can put the starting date of that event, because maybe it's a training with different days of duration. So we can put this the same day starting and ending, or with different dates. It's up to us. And now we go to the last two. Sorry, I'm going back to a few seconds. Now we come back to the main screen of the app, and we are going to check the last two features that we can see in the app. Is the two buttons that are in the top of the screen. We take the second one. We can send a message that is a predefined message to the coordination team, because maybe as a user, I have doubts about the intervention, about the application, or I want to stop using the application. So if I check one of them, the message is directly sent to the coordination team. And now we go to the dashboard, and if we refresh it, we see that indeed we have received that message from Ascensión, and that she has questions or doubts about the intervention. And also we can add a comment. Okay, I will call her tomorrow, or I have just called her and she was feeling anxious because the new version of Android doesn't work very well. So I'm supporting them with the UPB support or something like that. You can put the comment you consider necessary. And the last one, if we click to that point, the person can check the interventions they belong to, or they can do some configuration in the settings of the app as any other app in the world, or sign out if considered necessary. But we suggest not to do it without the supervision of the intervention staff. And yes, the person can check the interventions that they belong. And I think the video is ending. Yeah. So that's all. I'm going to stop sharing if I can. If not, Tamara, you can. Yeah, I can do it. So you have any questions about this now or later, of course?
I'm going to share the last slide. So let me know if you have any questions about any aspect of both health city generators or the Wakamola digital solution. Now is the time that we have the creators here. Tomislav?
Yeah, I would like to ask, can you hear me, first of all? Okay. I would like to ask whether the questions regarding the eating habits are connected with the thing, the problem, the issue that we spoke a few days ago. Is this mini eat or some other questionnaire, or it is not related?
For now is the mini eat because but for the one that you have seen in the video, but we have already changed it because we cannot use it anymore. So we have already changed it because my team already had it developed and programmed with the coding, so it has been very easy. So we are not using the mini eat. We are using another questionnaire validated, and that is the license it's free for us to use it without any kind of license.
Okay, thank you.
Yeah. So I guess the evaluation team will send an email to everyone with the final version of the questionnaire explaining which questionnaire we are using in nutrition. But this issue has been solved. Before going to Angela, who also raised his hand, Esme in the chat say if you still use Telegram for Wakamola.
We use it in other projects because, for instance, right now we have a project about patients with cancer and the relation with microbiota. And we have an agreement with a hospital here in Valencia, and they are using Wakamola for that purpose because it was done before we do this new version, this evolvement of Wakamola, and the patients are get used to this. So for this pilot is Wakamola, the original one with Telegram, but for instance, for HORUS, we don't plan to use it because we have invested time in this new technology to make it available both in Android and iOS. So the development you do for Android is like a mirror for iOS. So you don't need to replicate nothing. Only the sensor thing because it's more complicated for Apple, but it is more efficient to work with this new technology that we have been doing that frees us, as I said before, from a specific app that is Telegram. If something fails with Telegram, you don't have Wakamola anymore. So this makes us a new app, not dependent from anything.
Thank you. Short answer, in HORUS we don't use Telegram. Angela?
Hi everyone. Well, first of all, sorry because my camera is not working today, but I want to say that this is really amazing, the digital tools that you showed us. I have been working in urban health a lot of years, and this tool and the generator, it's really amazing. but I have several questions about it. So I will start with Ruth, and then have also a question for the Wakamola. So for the generator, the Healthy Cities generator, I want to ask first, how did you select the list of urban health determinants and health outcomes? It was only based on your literature review, or, for instance, did you set up a panel with the cities involved in the project and had like a participatory process to select the most relevant indicators, because they can vary from city to city, right? So I am really want to know how that process was made. The second question was about the assessment, so the baseline assessment. So, for instance, I am working in a municipality, for instance, Cascais. So how do I do that? I upload information, data about each indicator that you have in the tool, or it's only my perception about it, if it is bad, and how that judgment is made. Because, for instance, for the indicator of population density, we know that it's hard to assess if it is bad or good for the health, right? Because we don't know what is the threshold upon the health will be worse, So also on that indicator, I don't know how do you make the assessment, and I want to know. And the third question is if each city, for instance, is able to change the indicators throughout time. For instance, if in a city there is a health outcome that is starting to have bad performances, if they want to measure it, if they are able to add it to the tool. So it's about the evolution of the tool throughout time and how can it be shaped according to the needs of each city, for instance. And for the Wakamola, I just want to ask if because I didn't see very well in the beginning, if people that are responding to the chatbot, if they have a question in the beginning about the GDPR, about data privacy, for instance. If they if that thing is already addressed with, because using data about the health behaviors it's tricky after, and also if they have the opportunity to identify or select the residents, the place where they live, the municipality or the city or the region, because I am imagining afterwards the coordinators using this data and have to make a geography of the answers, and it would be very nice to have it also. And I think that's it. That's all. But well, congratulations, because these digital tools are really very, very good.
Maybe I can take this, Tamara. Thanks, Sankara, first of all. I'm happy that you're interested in it. It seems a relevant tool for you as a city planner. The first question, so where these urban determinants come from, we did a literature review. So basically the content of which aspects from the urban environment have an impact on health came from this review. But it's true that throughout the process, we also had a group of both experts and users. So the users were mainly people working within cities, and they were actually from different cities across Europe to ensure that what we were proposing is applicable also in different areas, in different contexts. And then the expert groups were more profiles from larger international organizations, research institutes. We had people from UN, from various research groups focusing on urban health, even regional governments, national governments. And the purpose of this user board was not so much to define which aspects should be included, because this, as I said, is something that came from the research, from the scientific evidence, but it was more to ensure that these were framed in a way that made sense to them, no, as practitioners and as experts on the matter, that the urban determinants that we included in the end were grouped and phrased in a certain way that made sense for them. The second question about the baseline assessment, how is this done? So there's no data required specifically from the user, so there isn't you don't have to upload any data to the tool. How it works is it's an informed qualitative assessment. So basically it's not like a questionnaire with each one of these 20 urban determinants of health. And for each one, what the tool provides is a list of guiding questions and criteria that again also come from the evidence. In some cases, when there was enough evidence available, we included some specific numeric ranges. For example, in population density, we did find this optimal range that is recommended is between 50 and 150 dwellings per hectare. So where this information was reliable, we did include it. But again, these ranges are usually fairly large, no? So in the end, we provide a series of other questions that are more based on qualitative input. And we rely on the user's perception also, no? To adapt also these criteria to their own context, as they have, we understand a very in-depth knowledge of their own context, so they can adapt the rating depending on this. And the last question about, if I understood correctly, it's whether it's possible to kind of run this assessment over time, so at multiple different time points. In this case, no. So the way the tool works now is you set up one plan and you have the baseline and then the plan stage, no? So these two different time frames. But if, let's say, maybe in 5 years' time, you wanted to do another change, at the moment, you would just have to set up a new plan or modify the one that you set up initially. Yeah, I'm not sure if that was clear. If there was anything else that I didn't answer, please let me know. But if not, maybe... Yep.
Thank you, Ruth. Yeah. I'm wondering if they don't put the data, how do you make like the economic evaluation, the return on investment models without data?
Mm-hmm. So this is based on the degree of impact. So based on the impact that the user has established,
Qualitative, right?
Qualitative, yes. But we did run another research project that looked into finding costs, so linked to each health outcome, each health indicator, for example, cardiovascular diseases, type 2 diabetes, depression, anxiety, also within mental health. We found ranges of how much these issues cost the countries, the governments across Europe. So we found these estimates, and this is how we provide the specific economic cost for the plan intervention, depending on the impact on the health indicators, which the user establishes, and then based on the evidence that we found, we establish the cost linked to each one. We have actually also included the option for users to be able to adapt these costs. So if you have information for your own city and you know these costs in more detail, and you can change this. And this means that the results that we provide are then a lot more accurate to your own city and your context.
Okay, thank you, Ruth. Just a clarification, because maybe I was leading you wrong. I was giving an example of, well, if I am a city planner working in the city of Cascais, because I'm from Portugal, but I'm not a city planner, I'm a researcher from the University of Coimbra, and I work with city planners because we do urban health plans. So that's why my interest in this webinar, but I don't work in the municipality, just a clarification.
No, but really nice anyway that you're interested in it, find it relevant. So thank you.
Yeah, very relevant. Thank you so much.
So I take the floor to respond to the Wakamola questions. The first one is the one related to the GDPR. I completely understand your point, but in this case, as the use of the Wakamola is associated with the project, with a study, we haven't included anything, any kind of clause within the app, because the participants that they are going to use the app before any kind of use of the app to download it or whatever, they are going to sign a consent form. So there they are informing about how their data are going to manage, not only the data related to the initial questionnaires or the interventions, but also the information collected through the app. So in this case, it is not necessary because the participant has been already being informed in a conversation with a coordinator or a researcher. So, but in other cases, it's possible, and we have included that, like a clause that, are you aware that you are going the sensors of your mobile are going to be activated, so the people can check and click in a more conscious way that they are providing consent for that. So in this, for that is no problem. We could, for instance, program that in another case, in another scenario where the app could be used. And the second question about the areas where the people belongs or the people moves in their daily life, it's more or less the same related to the one answer, because as this use is related to is a frame within the HORUS project, the pilots have already identified the cities, the neighborhoods that participate in the study. So in this case, it is not necessary for the user to identify into which neighborhood they belong or they live, because it is very packed and it's not going to be a full deployment in a bigger community or in the city as a whole. It's only in the specific neighborhoods, and the intervention groups and researchers are dealing with this kind of information. But as you have seen the questionnaires that Wakamola is asking through the chat, these questions can be personalized and until infinite. So you could include whatever you consider in terms of sociodemographics, the questionnaires you consider, and as well as statistics or the outcomes, how the person sees. It's going to depend on the questionnaires we are programming. So it is very flexible. It's a very flexible solution that is adaptable to different kind of studies, pilots, or a bigger deployment. I don't know if I have replied to your questions.
Yes. Perfect. Thank you, Ascensión.
Thank you, Angela.
So any other question? Everything clear about the tools? So if so, we were perfect on time, almost 12 o'clock. So thank you for your attention, and I hope to keep disseminating HORUS and that you will follow along. So see you in the next webinar and see you in the next meeting for those who are involved in the project. Thank you for your attention. Bye.
Bye. Thank you.
Thanks, everyone. Bye.